Household air pollution accounts for 1.6 million deaths globally. Most of the people affected are women and children. It causes chronic obstructive pulmonary disease. It can also contribute to development of TB, pneumonia, and globally speaking, it's a public health issue that's not incorporated into health objectives. I went to South Sudan a few years ago. There was a woman breastfeeding her child. The child was probably 4 months old. He said that's a very good practice in terms of protecting health, to be breastfeeding the child. And at the same time, someone else in the room had just completed cooking, and the room was full of smoke. And this smoke contains particulates of a very small size that get into the lungs, they irritate the lungs and cause problems then, but also can predispose you to other respiratory infections in life as well. So that's another kind of an environmental health issue. And even kind of, we have to mention, I think, non-communicable diseases, because globally the trend is changing. The number of communicable diseases has come down. And in terms of child mortality, in 1990, 12 million children were dying every year from communicable causes. Now we're down to less than 7 million. So there has been massive progress made in relation to reducing the burden of communicable diseases, even though we still have a major problem in places like sub-Saharan Africa, and particularly in children under 5 from diarrhea and respiratory infections. But the non-communicable disease burden is on the increase, and it's time that we looked at the issue of tobacco. Tobacco, I didn't get to see it now last night. There was a TV program on BBC Two about the burning desire and how tobacco is being promoted in developing countries. And the biggest killer in the world today is tobacco. And it also affects poor countries, and it also affects poor people within poor countries. So if I'm looking at the realm of environmental health issues, we've got problems with water supply, though in fairness that has been pretty much high up the political agenda, not as high as maybe some aspects of health. Sanitation is very low down the political agenda. Hygiene, washing your hands, we have very poor rates of washing hands in developing countries, as low as 19% of people washing their hands after going to the toilet, and that has a major impact in terms of reducing diarrhea and respiratory infections. Then you've got issues around vector control linked to climate change. So you're expecting an increase in malaria, for example. We're seeing a massive explosion of dengue fever, particularly in urban areas, as a result of increasing temperatures and increasing urbanization. You got overcrowding, which contributes to many communicable diseases, including measles, which I know that we can address now through immunization. Then you've also got the household air pollution that I mentioned, and then the tobacco control. And then climate change as an overarching issue is a major environmental health hazard. And we need to mitigate climate change by reducing our greenhouse gas emissions. And then we've also got to adapt to climate change in order to reduce the risk to vulnerable populations who are most affected by climate change.
So as a WASH expert, you work on all these things, do you?
Yeah, I'd call myself WASH environmental health. So I deal with the standard WASH stuff, which is the water, sanitation, really meaning excreta management and waste management, and then the hygiene mainly around good hygiene behaviours such as hand washing. But then I also examine issues such as vector control, site planning, particularly in refugee camps, and then household air pollution. And I would certainly advocate that we should be addressing tobacco as a development issue within Irish civil society organisations.
How can cigarette companies make big profits or big enough profits in developing countries if like the people are on like say a few cents a day? Like how much does a pack of cigarettes cost like in a developing country?
I don't know how much it costs, I don't smoke. I don't buy the cigarettes, so certainly the cigarettes are an awful lot cheaper. And maybe they're not taxed to the same extent. I'm not a tobacco expert, so there's other people that can talk to you much more knowledgeably about tobacco. But it's again, I was watching the documentary last week. You know, if so many consumers of tobacco consume tobacco over 30 or 40 years, and you maybe only buy one cigarette a day or 2 cigarettes a day, that's a consumer over a very long period of time. You might invest in the toilet once or twice, but if you're continually buying tobacco, and it's made affordable to you, if it's being sold as a single cigarette or 2 cigarettes, you might be able to afford a single cigarette. Whether you wouldn't be able to afford maybe 20 cigarettes, but you can buy a single cigarette. So we need to look at the evidence. We need to identify this as an issue. It's what's killing people, and we need to look at who is consuming the tobacco. I had an intern when I was working in Concern 10 years ago, looking at this issue for me in Kenya, for example, to see who were consuming the tobacco. And it was poor people who were purchasing tobacco, and it was also having a knock-on effect. If a man in the household was buying cigarettes, then it limited the disposable income for spending on food, for example, which was having a nutritional impact maybe on the children as well. So it's not just in terms of the consumers of the tobacco and the damage that it's doing to the consumers of the tobacco, but there's also the wider implications in terms of reduced disposable income in the household that's also having a negative impact within vulnerable people such as children, which is what many people say. That's what we're focused on, is the vulnerable. But I think tobacco is the biggest killer globally. You're going to have 8 million deaths per year from tobacco-related deaths by 2030, and 70 to 80% of those deaths will be in developing countries. At the moment, if you look at HIV and AIDS, which has been a major kind of development issue, I think that's around 1.7 million deaths per year. So tobacco kills 4 times more people, and it kills more people in developing countries. And the trend, generally speaking, is for more non-communicable diseases, even in developing countries. So diabetes is on the increase, cardiovascular disease is on the increase, cancers are on the increase, and of course tobacco is strongly linked to cardiovascular disease and also to cancer such as lung cancer.
But more people, are you saying more people are dying from cigarettes than anything else? Or
than anything else? Well, more people are dying from
except from food.
From cancers, for example.
From cigarettes, like.
Partly linked to cigarettes.
Yeah.
So you wouldn't attribute everything to tobacco, but tobacco-related deaths are said to account for 8 million deaths by 2030. I don't have the reference here.
8 million.
8 million per year.
Per year.
Yeah.
And that's more than dies from hunger, is it?
It's very hard to put a figure on hunger,
Yeah.
because malnutrition as such is not a disease.
Yeah.
It's a contributor factor to maybe somebody dying from diarrhea, or they're dying from something
Do you know how many
else.
die from like how many children die that are under 5, like, you know?
Yeah, at the moment it's just, I think it's under 7 million per year under the age of 5.
So it's
and
around the same as tobacco. The two of them are way ahead.
The tobacco is much more.
It's
Much more. I mean, like if you're talking about 1.7 million deaths, or sorry, excuse me, you're right. Yeah, around 7 million deaths, child deaths per year.
And tobacco's 8 million.
8 million by 2030. It'll be 8 million. Yeah.
Okay.
So that's just another issue, that's not in the Irish consciousness as a development issue. I don't know of an NGO in Ireland or a civil society organisation that advocates that we as a country within our development aid budget should be investing in issues around advocating on tobacco or supporting programmes that help people to cease smoking tobacco in line with the Framework Convention on Tobacco Control. It's useful to highlight the readers of the British Medical Journal in 2009 were asked in an online poll what was the most important medical advance since the journal was founded in 1840.
Since the what?
Since the journal was founded in 1840. And what is surprising for many people is that they voted sanitation as the most important medical advance since 1840. So we have this body of knowledge to say that sanitation is very, very important in terms of delivering health impact, and yet from a perspective of development, we just do not invest in sanitation. And when you look at some of the figures, for example, the Irish Aid report of 2012, 1% of their bilateral funding went towards water and sanitation, compared to 20% on health and HIV and AIDS. So that's indicative of investment levels in sanitation. So I think that's important. And the Lancet Journal, if I may mention, the Lancet Journal, this is in 2008, where they said the shamefully weak presence of the health sector in advocating for improved access to water and sanitation is incomprehensible and completely short-sighted. Sanitation has languished at the bottom of the international agenda for far too long, and the global health community has been complicit in letting it stay there. This unacceptable situation must change now. So this is an editorial 6 years ago in 2008, And I would venture to say that the situation has not changed.
And who are the Lancet again?
The Lancet is a highly respected journal that many people in medicine would refer to. So you got the Lancet and the British Medical Journal would be kind of the two major journals for people working in healthcare intervention. So there are two things I wanted to say. And then in terms of the Sustainable Development Goals, one of the problems of from my perspective with regard to the Millennium Development Goals, is that water and sanitation was under MDG 7 on environmental sustainability. So many people didn't see it as being a health-related MDG. Many people refer to health-related MDGs in relation to MDG 4, MDG 5, or maybe in relation to nutrition, but many people do not refer to MDG 7 as a health-related MDG. And when you consider the readers of the BMJ said that sanitation was the most effective intervention with regard to health in the last 150 years, then the Sustainable Development Goals in the future should be articulating the water sanitation and hygiene. Because we haven't got an MDG target with respect to hygiene, there should be a target, I think, with respect to hygiene. Not just improved access to water, improved access to sanitation, but we need to be working to improving hygiene behaviours. Because it's sometimes in the absence of the facilities, if you've got good hygiene behaviours, you can achieve good health outcomes. So in terms of the future, I think that's something we need to be incorporating into the SDGs, the Sustainable Development Goals, for our 2030 targets.
And just to finish up now in a minute or two, I've had a long interview. No, it's very informative. It's highly informative, and enlightening. Like just to finish up talking about sanitation, this is the last thing I can think of. This in-depth talking to you in-depth. Like, were you in Ireland? Were you so toilets, having toilets in our houses, and they're connected to a sewage system for the whole area? If you live in an urban area, are there toilets that don't need a sewage system, if you know what I mean, to be connected? Because, like, for example, I think most people in Africa live in rural areas, don't they?
Yeah, well, I think but there is increasing urbanisation. But even in urban areas, there are very few parts of the world, perhaps old colonial areas, where there might be a sewage system. And even then, the sewage system is not connected to a sewage treatment plant. Sewage is being pumped straight out to the sea, and is also causing pollution problems on the coastlines. So very, very few people globally will have access to a piped sewered network for disposal of their excreta. So many people are dependent on pit latrines. A pit latrine is simply a hole in the ground where you defecate into the hole in the ground. Sometimes that is a poor flush latrine where you have a water seal and it's flushed away, so any foul smells that are created do not come back up the flush pan. But many people are using a basic pit latrine, or what's called a VIP latrine, a ventilated improved pit latrine, which can help to reduce smells and can also reduce the number of flies in the latrine. And as I mentioned, so many people are defecating in the open as well. So a very small percentage of people. What the UN categorise as improved sanitation in order to meet the Millennium Development Goals. Sometimes it's connected to a sewer, but it can also be a basic pit latrine or a VIP latrine. They're regarded as improved sanitation. And then bucket latrines, public latrines, open defecation, they're not regarded as improved sanitation. So sometimes it can be difficult to differentiate what is regarded as improved or safe sanitation as opposed to unimproved. But most people globally do not have access to sewage like we have in Ireland. We are at the top of the sanitation ladder. And that's what a lot of it is about. It's about moving up the sanitation ladder. Some people are not even on the first rung of the ladder, and then other people who are on the first rung, really, in order to have a public health impact, they need to go up to the next rung on the ladder.
That's great. It's very informative, like highly informative. Like I'm a bit of an expert now.
Okay. Yeah. You've gotten everything that I've gained over the last 23 years.
Yeah, I will talk to you again, Niall, after next year, after the Sustainable Development Goals come out. Hopefully there'll be a goal on on sanitation, and we can talk.
Well, there should be. I just looked up it. You prompted me to look it up. The Sustainable Development Goals.
Okay, go on, yeah. And
so there are proposed goal 6 secure water and sanitation for all for a sustainable world. So by 2030, provide universal access to safe and affordable drinking water, adequate sanitation and hygiene for all. So that is a goal.
Yeah.
Special attention to the needs of women and girls.
Yeah.
Okay, so that's some of the links that I was talking about in terms of sanitation in schools and getting girls to go to school. And menstrual hygiene seems to be quite an issue at the moment. And then by 2030, decrease by X percentage mortality and decrease by Y% economic losses caused by natural and human-induced water-related disasters. So when I was talking there about disasters and climate change, flooding events are the most common disaster as a result of climate change, and that's largely has caused the $1.7 trillion in economic losses globally since the year 2000. And the mortality levels at 1.2 million people have been killed by disasters since the year 2000. Maybe not so many of them by floods, because in floods, generally speaking, not so many people die, but many people get displaced and they might have health problems afterwards. Maybe the deaths would be like in an earthquake, for example. But there are people being displaced by climate change, by drought, and they're being forced into urban areas as a result. So that's another issue. And this Sustainable Development Goal, under the water and sanitation goal, seems to be capturing that issue around disasters.
Well, that's brilliant. So I know that's going to happen.
It's
so
going to
if there's
happen,
any
yeah.
big news, Niall, I'll be talking to you.
Right.
Feel free to contact me.
Sure.
Thanks very much.
Not at all.